depending upon what time you're watching this program. My name is John Glenn. I'm a member of the Mayor's Commission for Citizens with Disabilities. This is our February meeting. Today's actual date is the 27th. It is 3:30 in the afternoon. We meet monthly here at the City County Building in the Legislative Chambers, room LC-4. Not that you needed to know that, but I provided it anyway. We meet every month. It is the fourth Monday of every month. We have speakers talking with us, and we like to showcase how Omaha is serving all of its citizens with disabilities. Mike Masker is our chair. Mike is running late this afternoon, so he will be joining us in a second. And because of that, we do not have a quorum, but we will have a post meeting this afternoon to go over our official items of business and to vote and have that officially entered into the record. But as we usually do, we'll have a wonderful guest speaker this afternoon or this evening, and we'll go around first onto our committee members to have them introduce themselves to let you know who is made up in this committee and how they impact the city of Omaha. So to my right, we will go with Janae.
I'm Janae Opal. I'm an attorney with London and Morley.
Her name is Janae Hofer, and she's an attorney at Lamson, Dugan, and Murray.
And I represent citizens with disabilities.
And she represents citizens with physical disabilities.
And I will say that we are joined now by our wondrous chair, Mike Masker, to help us get through this meeting. Since I had to officially lead it, Mike is back to take over his duties. So if I had a baton, I'd pass it to Mike. Mike, it's your turn to introduce yourself and move on with today's meeting.
Well done, John. Well, we've been trying to recruit John as the as kind of the heir apparent, but John's got a couple things going on right now, but none the least of which was getting a master's degree, helping to open up a $100 million building, and a couple other things.
Just a couple.
And then he has to find time to do John stuff. So, so anyway, thank you guys. I appreciate it. Apologize, I'm running behind. Mike Masker. I'm with CHI Health Emmanuel Rehabilitation Institute. Been on the commission about 8 years now, so these guys are kind of getting tired of hearing from me. One thing I like to do as we kick off our meeting is just to remind folks why we're here. And our objective is to promote the quality of life, accessibility, and equity in all aspects related to the city of Omaha on behalf of and in cooperation with the citizens of Omaha who experience disabilities. Some of the things that we do on a fairly regular basis, as issues come up, we advise the mayor, the city council, city department heads, and other city of Omaha personnel on issues of access, representation, employment, housing, and quality of life affecting city citizens with disabilities and their respective families. Also, just to publicize the role of our commission. In fact, we're planning to have a meeting off-site next month to really to stop hiding our light under a bushel, if you will, and to give just folks in the community a chance to participate in the process and see what we do on a regular basis. So that'll be exciting. So, and just want to remind folks that this meeting will be televised every Tuesday at 7 p.m. on Cox Channel 18. We are on CenturyLink, and I always have to be reminded of what that channel is, so I apologize, I don't have it off the top of my head. And you can also find information on our commission on our website. If you go to the mayor's office, and then actually probably the easiest way to find us is to just do a Google search of Omaha Disabilities Commission, and it will take you right to our page. There's information on how to contact each one of us on there. It has should have our phone number and our email address. We do like to hear from our folks out there that view our meetings and attend our meetings, just on whether it's topics of services or things that might be helpful for you, and also if there are issues that you're running into that we might be able to at least elevate to the mayor's office and see if we can get you to the right folks that can make a difference in whatever issue that is. So we will have some announcements later in our meeting, so either click your DVR button and record this so you don't miss any of those announcements or any of the exciting moments of our meeting, or just have a pen and paper ready and you can take some notes toward the end. So we've done our quick introductions, and we did not have a pre-meeting that was official, but maybe John ran that.
We said we're going to have a post-meeting this time. And
So-
by the way, you do a much better job than I do at introducing the commission and our purpose, so thank you for that.
I just read it off a piece of paper. It
You know,
works well.
I felt like I was pulling an audible for the Huskers and did not do a good job. I didn't quite fumble, but I bobbled the ball.
No,
So,
you
Not
did,
at
you did
all.
a fantastic job.
thank you
Oh,
so much.
yeah, thanks,
Not at
John.
all.
Well, and
Yeah,
so
kudos, John.
yeah, so you've heard from Janae and me, so we'll probably I don't know who wants to. We'll
already
throw it
did
to Ed and let Ed and Mark introduce themselves as well.
You betcha. My name's Ed Armstrong, and I work for QLI in Omaha. QLI is a post-hospital rehabilitation center for persons with brain and spinal cord injuries, and I'm here on the commission to represent adults with severe physical disability.
Here comes the camera. Okay, hi, I'm Mark Smith. I'm on the faculty of the University of Nebraska Medical Center. I'm positioned at the University Center on Disabilities at the Monroe Meyer Institute, which is a program that is the University Center for Excellence in Developmental Disabilities for the state of Nebraska, and also the Center for Leadership Education and Neurodevelopmental and Other Disabilities. I'm also a parent of and a sibling to individuals with intellectual and developmental disabilities, and I'm here representing that population of individuals in our community.
Awesome.
John has to introduce himself.
Thanks, Mark.
John.
And John, sorry about that. I'm
No,
not
it's-
trying
it's
to cut
okay.
you off, I promise.
No, I didn't, when I opened this, I didn't want to just start stating what I did for folks. So my name is John Glenn. I'm Vice President of Development for Madonna Rehabilitation Hospital's Omaha campus. And Madonna just opened the facilities on October 4th last year. And we are currently taking patients. We serve folks with traumatic brain injuries, spinal cord injuries, neurological disease, and stroke with ventilator management, and then a pediatric population with that. So we're very excited to be part of the Omaha healthcare continuum, and we are moving toward getting the hospital ramped up to serve more and more patients in the 3 levels of disabilities I just talked about. So it's been an exciting time and a busy time.
And as I mentioned, John not only has got that on his plate, but about 6 other things that keep him busy.
Amen.
He's got, you just can't see all the balls he's juggling at the moment. So, no, great group, and I'm really privileged to be a part of this team and the passion that these guys share. Had an opportunity to join Ed and his team at the dedication of their one of their new buildings. It was dedicated to Dan and Linda Dietrich, who folks that know Dan Dietrich, who used to be a physician in Omaha before he passed away, and was at Emmanuel. I think he was the medical director at QLI for almost 20 years, and just want to do a shout out to Dan and Linda for all that they've given to the community. I know for QLI, they were instrumental, or Dan especially, but obviously Linda had to let Dan out of the house at times to do that. But some of the comments about Dan and how I'm not sure he ever collected a paycheck while he was doing that. It was just something that he was passionate about, helping persons that have had a spinal cord injury or brain injury. So really neat event, and was just happy to be able to share in that. But the facilities are fantastic, and the people that Ed gets to work with are also fantastic. So, yeah, neat event. One of the things that we really like to do is share information on services that are available in the community, and we're fortunate to have Eileen Brady with us today, and Eileen will invite you up to the podium. Eileen is the Chief Operating Officer with Community Alliance, and I'll tell you what, these folks do so much for the community, and we're excited to hear Eileen share some information on Community Alliance. Welcome, Eileen.
Thank you very much. Thank you for the invite, Ed. I appreciate the opportunity to come and talk with the commission, members of the commission. I was trying to remember, it's been a few years, but I think it was those early 90s when I actually served on the Mayor's Commission. But I don't remember exactly, so it's been a while though. So
Yeah,
I
I might
appreciate
have.
the
I
invite.
followed up, I think, after that. But so who was the commission or the chairperson? Do you recall when you
Don't recall. It's just been too many
was
years
Vance
now.
on there? When do you remember him?
I just don't recall.
Okay, that's all right.
I
It's
don't
been a few
recall.
years ago.
It's been a few years, yeah.
Well, welcome
Yeah.
back.
Yeah, well, thank you. Thank you. So again, thank you for the invitation. It's a pleasure to have an opportunity to talk to you a little bit more about mental health services in the Omaha area and what we're doing at Community Alliance. So my name again, Aileen Brady. I'm the Chief Operating Officer at Community Alliance, and I have had the pleasure of being part of this organization for almost 35 years. I will say I started when I was very young, so just so you don't get any ideas here, but it's been a real pleasure. Our organization is in our 36th year as an agency in Omaha, so we're not a real old organization, but I think we're pretty well established now in the Omaha and kind of Fremont area as well. So let me tell you a little bit about what we do. I gave you the agency brochure, but if you open that up and you see our mission statement, that really it kind of says it all in terms of the practicality of an organization like Community Alliance. So helping individuals with mental illness achieve their unique potential and to live, work, learn, and contribute in a community of mutual support. So it's pretty simply stated. That really takes us back to our founding mothers and fathers. We were actually founded by a parent group. It was two couples and a mom who said, we want something better for our kids. We want something that is going to support them in the community. 35 years ago, what was happening, people would go to the hospital, and usually that meant to a state hospital. We had 3 then, in Norfolk, Hastings, and in Lincoln. And what the parents were seeing was just that revolving door. People would go to the hospital, they usually would stay quite a while, and come back home with the parents. And what the parents said is, we're getting older, we want a support system for our kids in the community. And so they went to the Region 6 Behavioral Health Authority and said, can you help us look for something that's going to support our children? And there wasn't anything. This was 1980. And we didn't have the internet either, so we didn't really know what else was going on in other parts of the country, right? So what the parents said is, would you give us a little bit of seed money? We're going to write a grant. So they received a $5,000 grant to hire someone to write a grant to start an organization. So they got a task force together. Something really good happened out of that task force, which doesn't always happen, right? So it was a temporary adult task force that started. It started with every psychiatric hospital in Omaha and a few other parents. And they got together, they talked, and they really set the foundation for our organization. And the very first thing they said was, let's be practical. Let's do the things that help people on a day-to-day basis. Let's not duplicate what's already here in the Omaha area. We're not going to be associated with an outpatient setting. We're not going to be associated even at that time inpatient setting or outpatient, meaning med management, psychiatric services. So instead it was all about helping people live a higher quality of life. That's what it was about. It was helping support people into housing, support people in learning the skills they needed at the time, learning more about their illness, helping them get back to work. It was all about those things. And, we've grown a lot since then, but those were the fundamental principles in which the parents said, this is the kind of organization we want for our children, and let's not stray far from that. They also made a decision about being an independent organization, not being associated with another hospital, because they said, we want anyone to be able to access the services that Community Alliance would provide. We don't want the agency to be attached to one particular hospital or another. So I think another really, really good decision on the part of those founding mothers and fathers. So we've stayed really true to that mission over the years. And if you look down at the variety of services that we provide, what we have tried to do over the years is develop an array or a menu of services for people to come into the organization and choose what best fits their needs. So our mission, serving adults with serious mental illnesses. Now, we are currently serving a small handful of adolescents in a first episode psychosis program. It's a pilot program with Region 6. We're also working with Creighton Medical Associates, or CHI Creighton Medical Associates for that 15 to 24 age group in their first episode of their psychosis, trying to treat early and aggressive. So hopefully we can keep them in school or keep them at a job and not continue to have that illness, have them, how do I want to say this? We want to keep it from becoming a disability for them, so treat early. So oftentimes with mental health, the person will kind of bury some of those symptoms. They can feel some things happening or changing for them. Maybe they're off at college, they're seeing, feeling some of the symptoms of their illness, but they don't tell anybody. They tell no one because they don't want to be different. They don't want people to make fun of them. They don't want to admit that something might be wrong. They could go into a very deep depression, but what happens? They're staying in bed. They're not going out telling everybody. Their friends get tired of, the person not being around, not having fun. And then all of a sudden what happens? The parents get a call at home and saying, your daughter, your son, we've got him in the emergency room and something's wrong. We have a mental health diagnosis here. And the parents are like, what happened? We didn't know. Well, of course they didn't know because their daughter, their son maybe didn't share that information. So what we want to try to do is catch those symptoms much earlier than we have in the past. That's one of the changes in our system is let's catch it quicker, let's treat it aggressively, let's make sure they do not go down the path of disability. Let's keep them in school, let's keep them at work. So that program is new, it's a pilot. We're only serving, like I said, a small group of people right now, but it's an exciting program that we just got started in. But the traditional kinds of services have been for adults. And we have been around, like I said, right at the 35, 36 years. And we are providing we're providing outpatient, med management, and therapy services all the way to that vocational training and helping people get in touch with employers to have a job and everything in between. So as examples, we do have housing programs. We have apartments that we own that we sublet to, or not sublet, but we rent to those individuals that we serve, and then we also provide the supportive services for them within that apartment. People are, either going to school or some might be working and some may not be. Some may have their illness at a level where they're not able to work. And that's okay. So what we're doing is we're helping them find what is that quality of life. Is it volunteering in the community, or it might be still learning about their illness enough to make sure that they're staying out of the hospital and staying well and working on their recovery. We also have been able to help people get back into the workforce, being a peer support specialist and using their lived experience to help others in the community who are also being introduced to their diagnosis for the first time, learning better ways of managing and coping with that illness. So we have the apartments. We also have group living scattered throughout the Omaha area. We have 6 residential homes that's at a level of care where usually the individual is coming from a psychiatric hospital and stepping down into a group living. They may stay there 6 months to 9 months while they're getting their life kind of settled down. Typically, individuals have had a high degree of symptoms, maybe been hospitalized a number of times at a psychiatric facility, and they just need some time to be in one spot, stabilizing with their illness, with medications, and also learning what it takes to be a good tenant again, paying rent, how to take care of yourself, how to take care of an apartment, and being a good neighbor. So those are things that we teach in our residential facilities. We also, in the last 3 or 4 years, we have developed a primary care clinic at Community Alliance. So you may or may not know the statistics, but the statistics tell us that for individuals, adult individuals with serious mental illness, they will die 25 years sooner than their counterparts without a mental illness. And you might ask why that is. Well, it is because of a variety of things, of course, but Oftentimes, a person who has a serious mental illness doesn't go to the doctor, so that it's not getting the preventative screenings that are so important. Medications can cause weight gain. We have diabetes issues. The other thing that happens, whatever this phenomena is, but there's a fairly significant rate of smoking within those with serious mental illness. And so we have the tobacco issue. And so there's lifestyle things and changes that we have to help people learn of how difficult it is to make those changes, but we have to teach them what the impact it has on their health. So we started a primary care clinic. And the reason that we did that is that we knew that our clients were not going to a regular primary care clinic in the community. There's got to be a little bit higher level of patients. We knew that we had to make it convenient. And the federal government said, you know what, we agree with you, and started 6 years ago now, providing SAMHSA dollars, Substance Abuse Mental Health System Administration dollars, to start these programs. So we were a recipient of a SAMHSA grant to start primary care services at Community Alliance.
That kind of leads into my question. Hopefully I'm not throwing your
that's all right.
Your presentation
No,
off,
that's fine.
You mentioned some of the issues that might shorten life expectancy, and then you hit on the substance abuse piece. Does that play into that life expectancy piece, and is there a prevalence of self-medication or substance abuse that you guys see?
Absolutely. The co-occurring illnesses with mental illness and substance use is quite high. In the entire population, we're looking at least 65%, if not higher. But we also work with individuals who are homeless in our community, and when you start looking at the individuals who are homeless, then that jumps again to probably 80, in our case, to about 85% that have the co-occurring. And it absolutely contributes because whether that's drinking or drug use, that's going to affect your kidneys, right? And a lot of other things. Yeah. So there's absolutely a tie-in there. So we address that as well. So from our staff perspective, we address co-occurring and trauma. Trauma is significant for those that we serve, whether that's happened within a hospital or whether that's happened for the folks who are homeless on the streets or in the shelters, or whether that is their experiences because of their illness. There's still such a significant stigma that's attached to mental illness, and the people that we serve can experience that in their daily life, at the bus stop, at the grocery store, where they feel they can be treated differently. Their illness may not be visible, but people, as they interact, may experience symptoms at these different various locations, and then the person feels stigmatized. When we started our primary care clinic, our clients told us that they didn't go to the doctor because as soon as they told them they had their primary care doctor, as soon as they told them they had a mental illness, they would say, well, they acted like I didn't understand any of the medical terms they might be telling me. They started yelling, almost yelling at me, talking loud as if I couldn't hear them. Or they just said, you know what, I don't think I'm taking new patients right now. So their experiences were negative. So when we have a primary care clinic who can kind of cater to their needs, and at the same facility that they're used to going to at our location where they come for psychiatric care, they can get their medical care. And then in 2016, we added a pharmacy. Now, it's not Community Alliance Pharmacy, it's not a retail pharmacy, it's a pharmacy that their business model is specifically to embed in behavioral health organizations. So all of you could not get your medicine there, but it's our clients. So they cater specifically to the people that we serve.
Sorry, I keep interrupting.
No,
but
that's fine.
It's a fascinating model. So your primary care clinic is for general health related issues.
For those that we serve.
Oh, that's it. So I was thinking when you mentioned it, it was more specific to mental illness, but
no,
it's just
medical.
Really.
Yeah.
That's great.
Yeah.
Awesome
Yeah. So we
concept.
have a advanced practice registered nurse, APRN, who actually does the primary care service, and across the hall is our psychiatrist, who does the behavioral health care. So we use the same electronic medical record. They can talk to each other. Like I said, they're across the hall from each other. So the person comes to the same window for their psychiatric needs as their medical needs. Yeah, yeah. And they can get their medicine, just about 5 steps away, up the 5 steps, and they can get pick up their medicine for the day. So it makes it very convenient. And at that same location, we have our day rehabilitation program, and some of our staff, our office there as well. Many of our services, though, happen in the community where the individual actually lives, works, and plays, and it's out there. Our vocational staff, for example, they rarely meet with someone in our office. They're out with them at their apartments. They're out with them, introducing them to employers. They're working on resumes. They're at the do space, getting things set and ready to go. So, yeah. I just want to talk a minute about our homeless program. We have a specialized psychiatric clinic that's free, and we do no billing for that for individuals who are homeless. We also have we work with the rest of the community homeless providers in Omaha for a specialized outreach team for street outreach. We do have about, I would say between 50 and 75 people who are pretty consistently outside. That might be on the trails, camps on the trails or the riverbanks, various places in Omaha. It's not just south and east Omaha, but we have several camps that are in west Omaha. And so we're continuously visiting with them and working to find housing, bring them in off the streets and get them into housing. They are not in the shelters for various reasons. Many times it's their illness that keeps them away. The shelters are busy, they're full, there's a lot of chaos sometimes, and so the people that we serve sometimes do not want to be there. It's just too chaotic. So we have a pretty active street outreach. And then we do a lot of shelter in-reach, it's called. So we're working hard with all the homeless service providers of getting folks housed, trying to reduce our not only veteran homelessness, but general homelessness to a smaller and smaller number. That still is a fairly significant issue for us in the Omaha area. And it's still something that we need to keep working on. We have a pretty good collaborative approach that takes place in Omaha among all of us that do this kind of work, but there's still a lot more work to be done in that particular arena. When you look down all of our services, our homeless program is one of our growth areas. And I don't like to say that. That's not what we want it to be.
Sorry, that's just fascinating. Do you have an estimate on what are maybe the latest estimates on the number of homeless folks in Omaha in this area?
So at the end of January every year, we do what's called a point-in-time count. So we don't have the data we don't have all that information compiled yet. But this past year, I do know we were this was a cold January night, so that we had about 50 that were outdoors. Now, that is a little bit low because it was a really cold night in January. A few more people went indoors. I would say if we did that point-in-time count in June, we're going to be at that 75 mark that I talked about. That's why I said 50 to 75 outdoors. Well, so when you look at the people who are staying in the shelters just in the Omaha area, we're going to be right at probably 2,500 people. Yeah, in the ballpark of Omaha Council Bluffs area. Yeah. So the 2 largest shelters with Santa Francis House and Open Door Mission, they'll sleep on a cold night. They're going to sleep over 500 people just in the shelter part. Yeah. So it's a lot of folks. It's
bigger than half the towns in Nebraska.
Pardon me?
I said that's bigger than half the small towns in Nebraska.
Yeah.
If you think about it in comparison.
A lot of folks.
And you mentioned earlier that of the 2,500 folks, that up to 85% have some form of mental illness.
So Community Alliance really specializes in serving those who are homeless with mental illness. So when you look at the group that has a mental illness, it's the 85% and co-occurring. When you looked at the general population of homeless, I'd say it's probably not that high. It's probably back at that 50 to 60%.
Okay.
Yeah. Mm-hmm. And just to what Mark mentioned earlier, with the co-occurring substance use and mental illness, oftentimes people are using alcohol to self-medicate. The other thing that our clients have told us sometimes is that the mental illness might kind of blunt their feelings The medicine might blunt their feelings, and what alcohol can do is help them feel something. And that is another reason why people have said, you know what, I'm drinking because at least I feel something during that time. Yeah, so that's kind of a sad scenario too. Yeah.
Come on. So Aileen, when you think of like all of the different programs that Community Alliance does,
Yeah.
about how many people is your organization serving in the metro area?
So on an annual basis, we serve between 26 and 2,700 people a year.
Okay.
Yeah. And folks can be involved in a variety of programs at the same time, but that's an unduplicated count.
Okay.
Yeah.
And what's your, in terms of sources of funding and to fund your programs, I mean, what do you draw on? I mean, what helps fund your operation?
Yeah. So the majority of the people that we serve, when they come into our organization, they do not have any form of insurance. And we are in the range of, won't even say it, about 95% of the folks who enter into our services are at or below the federal poverty guidelines. Typically, though, zero income. One of our programs is called SOAR, Social Security Outreach, Access, and Recovery. We help folks apply for disability. Mostly we prioritize those who are homeless because of their situation, their scenario. So we help people get on disability, and therefore Medicaid can be one funding source for us. Behavioral Health Region 6 helps fund those individuals who do not have Medicaid. And then we are, honestly, we're looking for this is a wonderful Omaha community that provides some financial support for some of our programs that do not have government support. But majority of our services are funded by government funds. Medicaid, tiny bit of Medicare, and Behavioral Health Region 6.
Thank you. One of the things I was wondering as you were talking, you talked about how some of the ways some people can access Community Alliance services, but I'm thinking of like a family that is just kind of coming into the situation where a family member is experiencing a severe mental illness or showing symptoms, whatever the case may be. How would they approach accessing Community Alliance at that point?
Thank you for that question. That's a great question. So people can just walk in our door and ask to talk to our assessment staff. They're available, and they'll sit down and they'll walk through all of our services. They'll listen to what that family is feeling like, what their needs are, and try to suggest or pair up some of our services to their needs. We're also well aware of other resources in the community. We can help them make some connections. I would also say that, just to point out our family education program, it's not a government-funded service, but it can be available to support the family. It's not a service directly for the individual with the illness, but it's for their family. We know that people's recovery will be enhanced by them having family support. So if we can help that family become educated about the illness, figure out how they can better support their loved one, then that person is going to have a better chance for recovery and to stay in recovery. Oftentimes people, this illness is very hard on families, and oftentimes they're worn out, they're tired, and our family education program can provide that individualized support to the family members. And we also work with the National Alliance on Mental Illness in providing a 12-week family-to-family education course. I can't tell you how many families have opted to come to a course 3 hours a week for 12 weeks, always in the evenings, because they're working during the day hours. So we do this in the evenings. So by 6 to 9 o'clock, once a week, they're coming in to learn. It's fabulous. We've had moms and dads, aunts and uncles, spouses, grandma and grandpas, cousins, all kinds of people who've come in and said, I want to know how I can be a better support system to my relative. It's fabulous. So they can come for that piece too. And you don't have to have your son or daughter involved in Community Alliance services for the family to access family education.
Awesome.
They can come on their own just for themselves.
Oh, that's awesome.
Yeah. But otherwise, just walk into the agency and and ask to talk to one of our assessment staff, and we'll get you connected.
Aileen, you had you just mentioned that there's a maybe a little bit of a stigma with mental health, but I think it's more prevalent than people realize. Do you have any rough data on just the number of persons that are affected, whether it's a percentage of the population or numbers in our local community that deal with mental illness and just in general, so we give folks an idea of that if you're suffering from mental illness, you truly are not alone. There's it's a higher number than I think people realize.
Yeah. Well, the easiest number I can give you is 1 in 4 families. So, I mean, just look, just in this room, 1 in 4 families have an experience of a family member, a close family member with a serious mental illness. So we know that whether that's schizophrenia, whether that's bipolar disorder, or major depression, that it impacts all of us. We know either a family member or a coworker, a neighbor. And just to speak to the stigma, it wasn't that long ago where 2 women had come together for this particular event, and they had carpooled to work for a number of years. And they came together with this event, and it was a mental health awareness event. They had carpooled for years. They had never spoken to each other about their personal experiences with mental health. And so it was at that event where they talked about their children both with mental illness, but they hadn't ever spoken before. So that's a stigma. I don't mention that my son has this mental illness with the person I've carpooled with for years. That tells you there's a significant stigma. Yeah.
I really like, hearing about the family-to-family component that you built in and how you've made that available broadly. That's really cool. And I think something really hopefully folks that are listening can take home. I also was interested, you had talked about that you were working with Regional 6 in partnership for your adolescent initial psychosis episode. Can you talk a little bit more about that in terms of like the numbers you're serving and maybe what some of the goals of that project are? And if you feel like talking more after that, kind of what the interconnection is between Community Alliance and Region 6.
Okay, sure. So the first episode psychosis program is intended for ages 15 to 24. So we really have two pilots going on at the same time. The one is with the first one that started last fall, or it was actually last summer, with Region 6, Heartland Family Service, and the state of Nebraska. And the goal was to serve 8 to 10 people. So we've served, I think, 7 in that particular model. And what we want to try to do is access or get psychiatric care for these young adults. Not really, they're not adults yet. 15 is not an adult yet, but for these young people, and provide them early medication. So one of the criteria for this program is they have not been on medicine for over a year. It has to be less than a year that they've been on medicine, psychiatric medicine. So it's a first episode psychosis that they've experienced. Get them in soon, get them in early. So part of the team consists of a prescriber, social work therapist who can bring the family in for that family education piece, and then a supportive employment or supported education staff person to keep them in school or get them to work if they're at the working age. So the team comes together and works with that family, educating them, educating the individual about their own illness, and hopefully helping them to move on with their lives by treating that illness quickly. So the second partnership, their second pilot, is with CHI Creighton Associates at 35th and Dodge area. And that is working with their prescribers, Dr. Coley, and supportive employment and their therapist. And doing the same thing with that model. We're following the same model. It's called On Track. So it's an evidence-based best practice, and there's been a number of research, you probably are familiar with it. There's been some research that says, yes, it's effective, it's good. So we're just implementing small numbers. So in the partnership with CHI Creighton, It's also going to be a focus on 10 to 15 individuals. We just got that one started this spring. So just in the last couple of months. So we are just getting going with this, but we're seeing some good results. Interestingly enough, right now, there are no young women that have been admitted to the program. They're all young men. So it just happens that that's where we're at. We did not expect that, but at this point in time, all young men so far. So, good program.
I smiled when you were talking because in terms of the evidence-based practice component, it's knowing that, number one, getting to individuals early is a critical factor in terms of remission of symptoms, but also just the age range that you've identified is an age range that is where we see a lot of significant mental illnesses really emerge in individuals. So it just was, I thought, was very thoughtfully designed. So.
Is there something significant about 15? Is that generally when the mental illnesses first start to occur, or is it possible before?
It's very possible before, and we are diagnosing much earlier now than when we ever have. And I think that's part of our, I guess, improvement in our diagnostic abilities within our field. But it does seem like we are diagnosing much, much sooner. But what we want to try to do is get to folks before they've been on medicine for a very long time, so we can test out those medicines much more early. The other thing about the first episode psychosis program, it's not intended for individuals with bipolar disorder. It's intended for individuals that it's looking like it's going to be schizophrenia or schizoaffective disorder, not for bipolar disorder. That's where the evidence has shown this model has been most effective.
Cool.
Yeah. Could I add just one more program just to tell you about?
Oh, absolutely.
I'm just really, really proud of this particular program, and I think for the people that might be watching, it could be a very helpful program for folks. And that's the Safe Harbor Peer Crisis Diversion Program. So why is it unique? Number one, it's 100% peer run. It's people who have have lived with mental illness, are now on the other side of recovery, and are helping others get through their tough time, right? So this particular program has a warm line that's attached to it, as well as people can come and visit and stay if they're in a crisis for up to 24 hours. We're located in the Annex building next to Lasting Hope Recovery Center. If people go to Lasting Hope and do not need to be at a hospital level of care, they can walk down the hall and come to Safe Harbor. Or they can just call us from their home. Transportation is always a barrier, it seems like. So we get about 1,000 calls a month from folks, and we have about 35 visitors every month. On average, the people are staying about 4 hours. But if that diverts the psychiatric hospitalization, not only does it save our whole system dollars, but it saves that person from having to go to the hospital. People want to stay home. People want to stay with their pets or stay with their families. They don't want to necessarily go to the hospital. If we can catch that crisis early, divert that crisis, deal with that early, then maybe we can save folks from having to go to the hospital. That's what Safe Harbor's doing. It is a really nice, wonderful program. And I'd just like to mention that. People can visit, like I said, if they can get there in terms of transportation. It is on the grounds of Lasting Hope Recovery Center. So that crisis can be whatever that individual defines as a crisis for them. Whatever is bothering them, they can call, they can come and talk to the peer staff. We're open 24/7. Call and come anytime. So.
Yeah, we had the folks from Safe Harbor here. Was it last year?
Oh, okay.
Or just
Perfect.
a little over that. And
okay, perfect.
great.
Yeah.
I mean, that is a fantastic
Yeah,
program and a
it
great
is.
idea. I think the biggest challenge is not enough people know about it.
Yeah.
And I think that's the challenge with a lot of programs. I mean, you have
Yeah.
your model is so well laid out and defined, and I think just getting folks to the right track, working at a manual.
Yeah.
This morning I think we had 9 folks in the ER waiting for beds.
Yeah.
And there's always more demand than supply, obviously, and that's the challenge. But with programs like Safe Harbor and yours, it's I think that's the appropriate level for a lot of folks. They just need to address the issue, and it may not need hospitalization. So
Absolutely.
It's a fantastic program.
So I have one more handout for you. We've talked a lot about the symptoms and illness, and what I would like to leave with you on is the bright side. And so I have this handout that says "People with mental illness color our lives," and it will show you. I'll hand this to you here in just a second, but it'll show you all the people from many years ago to current who experience a mental illness, and yet look at the talent. Look at the gifts that they have provided to our society. So I want to leave this with you. Some really recent names that even aren't on here. I don't believe, but Demi Lovato, she has become quite a spokesperson for mental health issues in our society. That's fabulous. We need people like that, especially for young people, to step up and say, yes, I'm suffering with a mental illness, but here's what I can still contribute. So I want to leave this with you, but names the very first one on the list is Abraham Lincoln, right? Joe Pantoliano, Jeffrey Tambor, Dick Cavett, voice of Nebraska, Jim Carrey, Ted Turner, Picasso, Mike Wallace, Buzz Aldrin, Billy Joel, all have shared that they also have experienced symptoms of an illness. So I'd like to leave this with you too.
Do you have Winston Churchill on there?
Oh, I'm certain.
I think that's the surprising
Yes,
thing
he
for
is on there.
Yeah.
a
Yes.
lot of folks. But
Yeah, bipolar disorder. Winston
que-
Churchill. Yeah.
One question I would have, Aileen, maybe to allow you to I guess, wrap up or just express some thoughts in terms of, we know that a lot of our systems of support across different categories of disability and illness can get pretty stretched. And I know, knowing your organization in the past, there's always seems to be another person needing help.
Right.
What would your kind of vision for the Omaha community be in terms of where are the areas of specific need that we really need to be taking a look at to take the next step forward? Because you described some really cool things, and yet we know that there are still folks out there, that are waiting.
That's a great question. It's a difficult question because what we do know is that we need for people to be ready in their recovery or be ready for recovery. And that's partly our job as mental health professionals to help people see that there's opportunity for them. I guess there's two things. One, and they're on either side of the continuum, is number one, I really would like to see more work in our community done with those who are homeless. Whether that's an economy thing or that's a mental illness thing or that's something else, housing, but that kind of breaks your heart that people are suffering and they don't have a place to live. That's a tough place to be. I'd also like to see, I'd like us to be able to do much more work in our vocational program, getting people back to work. We have a very small program, honestly, and it should be much more robust. We should be able to place many more people back to work. We have some wonderful employers that we work with. I wish we could double that number. If we have about 100 now, I wish we had a lot. I wish we had 200 employers that were knocking on our door for workers. So I'd like to see that. And then I guess for me, the other piece that's really important is I've always seen Community Alliance as a safety net for individuals, especially those with the more serious mental illnesses. And the world has changed to managed care, much more shorter term services, and it makes a difference on where our housing resources are. When they're not in a service, they're going to have to rent with whatever finances that they have available. And for most people, that's $735 a month for everything. And so they're going to rent places that, I wish could be at a higher quality. So, housing, vocational, and, giving people a little higher quality of life would be where I would really want to put some emphasis.
Great, thank you.
Yeah.
I think one of the things you hit on, Aileen, is that, and we really believe and promote here is that it's the person first.
Yeah.
They are not their disability. They're not their
Absolutely.
mental illness. They're
Yeah.
not their physical disability. And
Mm-hmm.
when you mention everybody, it doesn't matter if anyone has a disability or not. It's about the talents and
That's right.
it's the gift they are. And I think you hitting on that is really kind of the motto that we all try to live by, is you don't see somebody for their mental illness or their wheelchair or their whatever their disability might be. It's the person, and by the way, they just happen to have a disability.
That's exactly
It's,
right.
it isn't who they are. So
Yeah, absolutely.
we thank you for
Yeah.
perpetuating that and taking that
Absolutely,
forward.
absolutely. Yeah,
Well,
strongly
thank you.
believe in that.
Yeah. Thanks for sharing the information. It's been great. We really appreciate it, and hopefully you'll come back and visit us again.
I would love to do that. Thank
Great.
you for listening.
Before you leave, if you wouldn't mind just giving your contact information, the best way to
Yes.
access your services and get more information, and
Absolutely.
then we'll let you go.
Okay, all right. So Community Alliance is located at 4001 Leavenworth Street, and that would be the location to just simply walk in our front doors and ask for the assessment staff. Our main phone number is 402-341-5128. And we just have one general number at that main office, so making that phone call if you'd like and asking for our assessment staff, would be happy to take your call and talk with you about services and whatever need you might have. So that's also the place to access the family program as well.
And then you have a website at community-alliance.org, is that right?
Community-alliance.org. Correct.
Perfect. Thanks, Aileen.
Yes.
We
Yeah.
appreciate it.
Thank you all very much.
You're welcome. So we have a few minutes left. We'll go around the horn and do announcements, and I'll start with John on my far left.
Thank you, Mike, and thank you, Aileen, for being here today. A lot of great information you gave to all of us, so thank you. As I mentioned earlier, Madonna Rehabilitation Hospital's Omaha campus opened up in October. We are continuing to serve more and more patients in the Omaha metro area, regionally and nationally. As far as an item of note, this Sunday, which would be March 5th, which is odd to think that February is going to be over and we're already in March. March 5th, out at the Mark in Elkhorn, we're having a bowl-a-thon to help raise funds for the Omaha campus. So if you're not watching Creighton and Nebraska basketball and the rest of the end of the conference tournaments for college basketball is weighing on you heavy, come on out and do some bowling and help Madonna. That's my one shameless plug for the day.
No,
No announcements.
Go ahead. I wanted to bring to everybody's attention that on I believe it's May 5th, boy, I hope I have that right, the Meyer Foundation for Individuals with Disabilities will be holding the Walk and Roll for Disabilities, which is a fundraiser for Monroe Meyer adaptive recreation programs, especially for adaptive recreation for adults with intellectual and developmental disabilities. To find information about that, I would recommend that you look at our website. That's UNMC, University of Nebraska Medical Center.edu, and then a / and then MMI, and that will give you all the information you need if you're interested in participating, contributing, want to have a good time. It's coming up in a few days, so that's the Walk and Roll for Disabilities that the Meyer Foundation is sponsoring. Thank you.
And hi, this is Ed from QLI. I'd just like to pass on that March is Brain Injury Awareness Month. And a good way to kind of find out a little bit about that is to get on the website of the Brain Injury Association of America. And their website is BIAUSA.org.
And again, my name is Mike Masker with CHI Health Emmanuel Rehabilitation Institute, where we serve persons with physical disabilities. We have a full host of support groups for persons that have had a stroke or family members that have had a stroke, brain injury, spinal cord injury, amputation. And those are all held at Emmanuel. The best place to find information on that is to go to our website at chihealth.com. And if you look under rehabilitation services, you'll be able to find a calendar of all of our events. We also have a full host of sports and leisure opportunities for persons that have disabilities, and they'll all be listed there. I believe right now we have bocce ball and wheelchair rugby, basketball's going on, but soon we'll be getting into tennis and fishing and softball, and it kind of goes on and on. So the thing that most people don't realize about Omaha is this really is a great hub of opportunity for persons that have disabilities when it comes to sports and leisure. So whether it's things that Madonna provides, or QLI, or Emmanuel, or the PVA here in town is a super resource for folks, as well as NWA, which is the Eastern Nebraska Wheelchair Athletic Association. So there's lots of great opportunities, and if you have questions on that, certainly you can give me a holler, and we can get you linked up with those programs. So, but if it's something that you have an interest in, there most likely is a resource out there for you. We've started wood carving in the last couple years. We have our wheelchair sports camp in the summer. So there's really a long list of opportunities for folks out there. So just a reminder, this meeting will be rebroadcast tomorrow night, and then every Tuesday night for the month. If you have any feedback or any questions, thoughts for us, you can find our information on the mayor's website, or the best place to go is just Google it and look up Disability Commission Omaha, and you'll be able to find our personal contact information. Our next meeting is March 27th. Our plan is to actually have it at UNO, and that meeting will be open to the public. That is if all things go according to plan. Otherwise, we'll be back here. So I'll have to make sure I let the folks know that run the show behind the scenes what we're doing. But again, you can find our broadcast on Cox Channel 18 each Tuesday at 7. Our meetings are held the fourth Monday of each month. We hold them in the Omaha Douglas County Civic Center, which is located at 1819 Farnham. Our pre-meeting starts at 3. Our meeting open to the public starts at 3:30 and goes till 4:30 on those Mondays, and we certainly welcome anyone who would like to join us. With that, we'll adjourn, and we'll see you all next month. Thanks, guys.